Hello everyone, welcome to the next The Rise Talk Show. And before I start today's session, do not forget to subscribe us on TikTok, YouTube, Spotify and other social media platforms. And today's episode is proudly brought to you by Super Boost Active Wellness Concentrate that you can always purchase on our TikTok shop. And a big thank you to them to support the Rise Talk Show. So today we have a remarkable yet a very kind doctor, and her name is Dr. Nithiyah Maniam. And let's welcome her and let's hear what we have from her today. Hello, doctor.
Hello.
Thank you for coming.
Thank you for inviting. I feel good. Thank you so much.
Yes, and you're so inspirational. And today I want the world to know about you. Raw, unfiltered conversation. Yeah?
Sure. Thank you.
Okay. So, doctor, let's talk a little bit about you. So what we understand is you were working a day-to-day job with a monthly salary, quite high-paying salary, right? And suddenly a calling came to you perhaps, and then you open up your own clinic, stopping that job, right? So maybe a little introduction towards that.
Okay, so my name is Nithiyah, first of all, to start off with. I'm also an occupational health doctor. Okay. I'm also a lactation counsellor. And I also major in women's health and hormones. Okay. So my niche is quite vast, first of all, to start off with. So this is my 11th year being a medical doctor, to be honest, because a lot of them don't trust. They come and see me, they'll be like, I don't trust you because you look too young to be a doctor.
Definitely.
So yeah, this is actually my 11th year. I completed my housemanship in Klang Hospital.
Oh, okay.
So Klang Hospital, everyone knows how crazy it will be and all that. So yeah, I did had a rough start, but I loved it. It was filled with adrenaline, and but that was where I learned about working hard, working long hours. It's like there is a saying, if you can survive in these 3 hospitals, usually in housemanship, we would say in the medical fraternity, if you can survive in Queens, which is in Sarawak, if you can survive in Klang Hospital, if you can survive in Penang, then you can survive anywhere also.
So you'll be the VIP.
Yeah. It's like
VIP
literally,
doctor.
yes, you are literally like, you will be treated really badly and the working hours are very stretched. So you can survive anywhere. So I was very proud HTA product lah. Okay. Then from there I went to Jerantuk, Pahang. Okay. I was in a rural area for 2 years. Okay. So there in rural area was where my interest in primary care actually sparked, because I was in a clinic kesihatan. It was betul-betul a rural area, but I loved it because of all the people that I work and my staffs and all the cases that you see are very different from what we actually encounter on a daily basis in the city.
For example? Why do you say it's different?
Because my patients were mostly orang asli.
Okay.
So the first thing that we had was actually language barriers. So I had to have like a translator. And then I had monkeys in my KK.
Really?
They have pet monkeys and they will bring the pet monkeys to the KK. And we have all kind of pets. And they'll be saying in movies also, sometimes at the back, and then there'll be patients who are coming like, doctor, there's durian at the back of the clinic. There's like sayo at the back of clinic. So the people are very nice. But the cases that you encounter you get to see typhoid, you get to see leptospirosis. You see cases that you don't really see in the city over there. Yeah.
Yes.
So 2 years I was there, and then I came back to HKL. Okay. I was in HKL for 2 years. HKL 2019 to 2029. 2021, sorry.
2021. Okay.
So 2 years in HKL, I was in radiology department. That's where I learned about scans. Yes. I was there for 2 years.
Cool.
So there, I was pregnant with my first baby at that time, and it was also COVID.
Oh wow.
Yeah, so it was very tiring for me. It was very exhausting, and I think COVID was the reason why I actually quit from KKN.
The burnout.
Yeah, I was
and you were
burnout.
pregnant.
Yes, I was pregnant. Yes, I actually quit after I delivered, but I think the main thing was actually the traveling. It was 132 kilometers for me to and fro every day.
Oh my.
Yeah, and by the time I come back, I was exhausted. I had a newborn, and it was quite taxing lah. I have very good family support. But personally, for me, it was very taxing, mainly because of the travel. So I thought, okay, I did not have any backup. I just quit. Okay. I just quit. Even my HOD, she called me to the office. She was like, stay 1 more year, you can get master, and then life will be different. And I told her, I don't think I can even stay 1 more day because I was mentally exhausted working there. So yeah, I quit KKM with no backup. From there, a month after that, I joined a company. It was a corporate company. I was their first doctor. And that was where I was first introduced to wellness. Okay, there's this thing called functional medicine, whereby we call it as preventive medicine. So instead of giving you medications once you have already gotten a disease, we try our level best to prevent it. So functional medicine practically like how we start on supplements like vitamin D, vitamin C, all this kind of things, and a very definitive kind of comprehensive testings, so you know what is it. That was the time where COVID was going on and the vaccine started. So I also ran PPVs. I ran PPV KLCC and PPV in Kajang, 2 PPVs. I was moderating and I was running there. So it was a very good experience from there. But it was also a little far for me because it was in Damansara.
And you still had a newborn, right?
Yes. So for me to travel was a little hard. And then at the same time, I got a job back in Klang. So I came back to Klang. 1 year only I was there, and then I came back to Klang. Yes. And I was very lucky. I had a very good boss. My staffs were amazing. I learned a lot from there. And when I was here is when I got pregnant with my second child. 2023 was
quite quick, yeah? From the first to second?
2020 I was pregnant with my first. 2023, so 3 years lah.
3 years, yeah.
By the time I delivered it was already 2024, so there's like 4 years gap. It was Caesar, so I feel like just nice my planning. So I was pregnant with her. And then throughout my pregnancy, I also had little complications. I had GBS. I had bleeding until 5 months of pregnancies. And I was still working at that time also. So, but I had supportive staffs and boss and my parents. So I was okay. I was still going until 35 weeks. At 35 weeks, I fell and I fractured my left ankle.
Oh my goodness.
I was heavily pregnant because I was 9 months pregnant. And then it was just a normal road. I was just walking on a road and I slipped on a moss and I fell and I fractured my left.
And you're still laughing when you're telling me this. I'm feeling so painful inside. Oh my god, but imagine at that time how you would have been.
Correct. Because I was so nearing my delivery, and there's this thing called VBAC, vaginal birth after cesarean. And my doctor gave me a green light. She was like, because my first baby was a Caesar, so she said, okay, Chante, you are all nice, your spacing is good, your health is good, so we can go for a normal delivery. And I was so close until I fell. So when I fall, I can't go for a normal delivery anymore. I was pregnant, so I can't go for op. They put me on a cast. I would say actually it's my fault lah, because I was supposed to be on a cast for 3 months. But when I went for my second Caesar, 4 weeks after that, I went for my second Caesar. I went with my cast on actually.
Oh my.
And then of course Caesar pain was very bad. So at that time, I did not feel the pain in my leg.
It was more.
It was more on the Caesar. So I was like, lantak lah. So I took out my cast already. I took out my cast and I was like, no, I have to heal my tummy first. You see, my core, and I have a newborn baby. I have a toddler, so I had a lot. My plates were full. I did not concentrate on my leg, and I think that was my first fault. This was I delivered my child in January 2024.
You know, when you're telling me this, sorry to interrupt, but you're a doctor, but you yourself
there's a saying,
take care of yourself, isn't it?
There's a saying, doctors are the worst patients,
You proved it right.
Correct. Doctors are the worst because we will advise others, but we won't listen to ourselves. That tend to happen.
You're just human, isn't it?
Correct. Because at the end of the day, we still want to, and I think end of the day, we are all mothers. And as mothers, we just look for others instead of ourselves. It tend to happen that way.
Of course.
So I think that. And then that was January, I delivered. March, so because of my fracture, I've been living in constant pain for the last 3 months.
Right.
I have been having the pain, but I kept ignoring it because I thought it was a fracture. Until one day in March, still remember, March 17, I woke up and I can't stand.
Oh my god.
I couldn't stand. I was like, this is not fracture pain. It's something different, because every time I try to stand, I have a very shooting pain on my left leg. It was going up all the way to my hip. So I was like, okay, this is not good. Then I called my friend. My friend, she's working in PPUM at that time lah. So she said, okay, this is not good. Come, let's scan. So we went to PPUM, scan, and that's when we found out that I actually have a DVT. So
can you explain what DVT is?
DVT is what we call as deep vein thrombosis. Deep vein thrombosis means that your veins, anywhere, it can happen anywhere in your body, the vein is blocked. It occurs because of external trauma. Like for my case, it was fracture. For some, it can be pregnancy. Even pregnancy can lead to DVTs because of excessive weight gain. That can lead to DVT.
Understand.
What else else can lead to DVTs? If you have any heart issues, kidney issues, especially those elderly men, they tend to have DVTs because of this. Inactivity, those with stroke patients who are not moving, that can also cause DVT for them. That's the importance of that ubat cair darah the doctor gave.
Yes,
a lot of people tend to ignore it.
But
they
it's
say,
so important,
yes,
isn't
it's
it?
very, very important. I even have like, there's a rule that if you're pregnant more than 100 kilos, you need ubat cair darah. A lot of pregnant mothers refuse to take it because they feel it's redundant.
It's redundant,
But actually it does play a very important role, and until you tak kena, you would not know lah. Like in my case, tak kena tak tahu. I was very hesitant. I wasn't on cast. So yeah, that was
So how did you go through this? I mean,
yeah, DVT was a very life-changing moment for me, to be honest. And when I had the fall, and I was like bonded to the bed, I cannot move because I'm a very active person. Even despite being pregnant, I'm still active. I did a lot of things. I was setting up a lot of plans.
Right.
And then when suddenly I'm bedbound, I cannot move, I cannot mandi, I cannot do anything by myself. I need assistance. Yeah, that was like a wake-up call for me. And that was when I decided, okay, you know what? I need to do something for myself. Because when you think, what is your next step? I was working under people, but what's your next step?
Right.
It's being your own boss, right? Yeah. And the next step, when I'm working under other people, I cannot achieve what I wanted to do.
Yes, what you have in your heart. You can't make it real,
correct,
right?
correct. It's like what I'm truly passionate about, because what I really like was to give awareness.
Yeah.
I'm a more of a let's prevent it rather than let's treat it. But let's be real lah, in GP setting, treating is what gives you money, not preventing.
Yeah, because you're saying, okay, no, right? So there's nothing there. If they get it, then you get the money.
Correct.
Yeah.
So
being empathy, I think not everyone has the quality.
Yes,
isn't it?
correct.
And you have it.
And when you are looking into money making, then you are not supposed to be empathy.
Yeah.
That's how you make money, to be honest, real world lah.
Right.
So I was like, okay, you know what? I can't do this. I want to do what I'm truly passionate about, and that's when I decided to open my own clinic.
So all this decision that you made was during your hardest period.
Correct. It was during my
babies.
fracture, my DVT. When I was having my DVT, when I was hospitalized, was when I was building my clinic. I still remember I was on the bed. The doctor requires me to lie down flat because the bolus, it can run anywhere. And if it go and get stuck in your lungs, can cause PE, which can eventually die. Yeah, so he was like, but I was sitting down, I was on a laptop, I was actually applying for MPK license. I still remember. And he walked in, he was like, no, this can't wait, because I need my licensing to put the signboard up, you see. Spent a lot of money. I can't...
Most likely your savings, isn't it?
Yeah, my savings, I would say 30%. But most of it, my dad was an investor. So he invested in it.
Thank you, Dad.
Yeah, thank you, Daddy.
That's nice.
But otherwise, it is hard-earned money. It's not something that comes for free. So yeah, I was rushing on that thing and all. So yeah, I guess that was my wake-up call.
That's amazing, because I just wanted people to know, when you make decisions like this, it's not like when you set it up, you're going to get tons of money flowing in. You need to build your customers and you need to have marketing plan.
Correct. When you're opening up your own business, you have to have that mindset. You're going to go on a loss for 18 months.
Right.
You have to open with that mindset. That you should have that. Whatever comes along the way, if you're going to pick up along the way, if you're going to break the norm and you're going to get it better within a year, that's adunga teramet. That's what people say. Yeah.
And a little bit of luck, maybe.
Correct. So go in with a mindset that it's okay. This is what I'm going to do. This is how I'm going to put. I'm going to put in my whole hard work, everything into it, and let's see how it goes by, you know.
Right. And all these raising 2 kids, right? And they're not grown-ups.
Correct.
They're little babies.
Yeah.
It wouldn't have been, I mean, I'm sure it was not easy.
It was not easy, but like I said, I had very good support. My
Support
parents,
system.
The good thing is, despite I was going through all these challenges, right, I had amazing support, and I have very good circle around me. My circle is very small, but I have very good circle. My parents were supportive. Even something as simple as my maid. I had my first maid and she was so good. I did not have any issues, tachula. But I did not have any issues from my circle. My friends, my family, my staff, my maid, everyone around me were very supportive. They were very uplifting. So I think I'm blessed in a way that I got this, even though I'm going through this. Yeah. So I guess it's like one thing lah.
That's great, you know. I mean, like you're sharing till this point is definitely going to empower a lot of people out there who are like having so many questions. Am I a loser or am I going to do something about my life?
Correct.
Because I think at one point we all think such a way about ourselves, right? But you have proved yourself by, you know, even on a sick bed, even while you're supposed to be flat. You know, but you still made everything happen. I mean, kudos to you.
Thank you.
Let's have a short break and then we'll resume. So we'll take a quick break and we'll be right back after a message from our sponsor. Don't forget to purchase Super Boost on our TikTok shop. Hi guys, welcome back after our short break. Before I start, once again, we would like to thank our sponsors, Super Boost, and let's go back to Dr. Nithiyah. Okay, so that was very, very enlightening, all about yourself. So now let's go to your work, you seeing people in a daily basis. So I would like to start with our teens and our children. I started following you and I saw a lot of your contents, and one of it you were actually talking about a mother bringing a daughter to the clinic. A teen daughter, right? I can't remember the age. But the mother seemed so dumb because you were telling her that the daughter is pregnant and she didn't know it. How can someone be so dumb?
Okay, to be honest, right, even I did not anticipate it. Because why? The girl came in with something which is a symptom which is very irrelevant. Okay, first initially she came in, she told that she had UTI symptoms. So I had urine, I have pain in my belly, I've been going for urine very frequently. So the mom was like, okay, I'm worried that my child might be having diabetes, which is not wrong. Okay, because urine, pain and then you're going urine frequently. It is a sign of diabetes. But the girl was like a moderate size, she's not very big, she's not very
How old was she, doctor?
She was 16 going 17.
Okay, so still in school, right?
Correct.
Okay.
So they were like, okay, so I was like, oh yeah, when the mother, she was like, I was like, oh yeah, true, might be also. So we did a urine test and it did came back as she had infection. So I covered her for antibiotics and all, and I said, okay, you can go back. So she went back. And then a couple of days later, she came back again. She came back again and then she said the pain is still there and then the urine frequency is getting more. So she was like a little bit worried, maybe the antibiotic not working, maybe need to up or what. Which is legit lah, valid actually if you ask me. And then I was like, okay, and then I was like, where's the pain? Then she told me at her lower abdominal. So I was like, okay, lie down, let me check. And then when I was checking, I did feel like a mess, like a lump on the stomach. And then I asked her, how's your period? And then she told me that, she menaki when she was 12. So it's like 4 years already. 4 years, so she said she does have irregular periods. She do have uterine fibroid. She said that she has been tested and she was noted to have uterine fibroid and irregular periods. So I was like, oh, where are you under follow-up? Then she said, not really under follow-up, on and off and all. So I was like, oh, okay. Then I told her that I can feel a mess. I'm a bit worried if the fibroid would have gotten bigger.
Exactly.
You know, because 16 years old, where we want to think of all that, right?
Course.
So we were like, okay. Then I said, okay, let's just do a scan. She was like, okay. So lie down, everything. The moment I put a scan machine on the tummy, I can see the baby's hand already. Like that. Yeah, it was there.
You can see the baby.
It was a 4-month-old baby. That's the reason why the stomach is visible. But there's one thing, dear, with kids, especially teenagers, the tummy would not show. Even they are 7 months, 8 months, even they are 9 months pregnant also, the tummy would not show. It's probably because they are small size, they are still very small, and I think the skin elasticity so it will not really show until it's like very late in the pregnancy. So I was scanning and I can see there's a baby, and I was like contemplating, Alama, how do I tell this to the mother and all that. And then the mom was there, she was also looking, and then she was like, okay, this looks like a baby.
Oh, the mom herself?
She told me, this looks like a baby. And I was like, then I told her, I just turned around, I said, yeah, it is a baby. And she was like, she was stunned, the girl was stunned, I was stunned because I did not anticipate this. So when this goes on, the mom, she just woke up, and she just walked out. That's it. She just walked out. Then I was like, okay. Then I asked her, okay, now you have to tell me the truth. Then she was like, no, doctor, see properly. I was like, I'm showing her. I said, this is the head, this is the heart. Can you see the heartbeat? I even on the Doppler and I say, can you hear the heartbeat? Tuk, 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 tuk. There's a heartbeat. I said, this is your baby is 4 months old. Now is the time, please tell me the truth. Until she goes out from my room, my dear, that entire thing, I even told my staff, okay, you know what, tell the patients outside, this is going to take time because we have some family counselling going on, just tell them, give me some time. It took an hour until she goes out of my room. She did not admit that she has a boyfriend. She said, no, I got no boyfriend. No, I've never done anything. No, I don't have. The mother is outside. I said, no, ma, you tell me. It's okay. Let's work something out, right? Nothing at all. Yeah. And yeah, I mean, I have no idea what exactly happened to the girl after that, but that entire thing, that entire conversation that I had with the girl, right, it's not that she doesn't know that having sex will lead to pregnancy. It's not that she doesn't know about contraception.
Okay.
It's not that she doesn't know how we actually can conceive. The ignorance. I got fibroid, I got irregular menses, so I cannot get pregnant.
Okay.
Huh.
Oh, okay. See, now you're telling something that a lot of people don't think about.
Correct.
So they keep doing it. They keep having sex, thinking that I have an underlying issue. I can have sex as much as I want.
Yeah.
I will not get.
Yes, correct. That was her cause.
And these are kids we're talking about.
16 years old girl. You won't be surprised. I have a patient. She came in, but this was, I think, a mother which is a little bit anxious.
Okay.
She came in, she brought a daughter. The daughter is Form 1, 13 years old. So apparently, they had a spot check.
Okay.
And her close friend, which she has been friends with since 7 years old, both of them are close friends.
Okay.
And they found condoms in the close friend's bag.
13 years old.
Yeah.
Condoms.
Yeah.
Okay.
And the mother, this girl, the mother got anxious when she heard this story because these two are close friends, right? She was worried that the daughter might be doing something, and she brought the daughter to me to consult and to speak about the daughter, to find out what if something has been going on, or she's aware, or what's going on and everything, to me. To ask the daughter and everything lah. And 13 years old girl, you know, I was equally shocked when she told me this story, and she was like, okay, doctor, you talk, and then she just left me, and I was looking at the girl, and the girl was looking at me. I was like, do you know what is it for? She was like, yeah, I know, doctor, I know what is it for. I know she is doing it, but not necessarily I am doing it, right? I was like, yeah, I know. But the good thing about teenagers nowadays, they can tell lies so beautifully.
That's a good thing. Seriously, that is giving me anxiety top level right now. But that is the reality, isn't it?
They speak it so convincingly that
even you believe
yeah,
them.
even we'll be doubting ourselves. We'll be like, oh, okay, maybe I'm the one who's like a bit, being anxious, or I was the one who's not so correct, or what. Yeah, that tend to happen also. 13 years old.
13 years old. So at that particular time when she's saying the friend is doing it, but not necessarily me, do you think so you feel it was a lie?
To be honest, right, I have no idea, because
so
the
hard to
way
predict.
she was talking was so convincing. And as a third party, even though I'm a medical professional, even though I'm a healthcare, there's only a certain limit that I can go to.
Yes, of
no
course.
matter what, I think it's always the parents who has to play the role in giving proper sex education, in actually telling the kids what is it about, how is it about, what is actually a period, how do you actually get pregnant, what is the usage. But kudos to the girl for being safe lah.
Yes, because this is not normal in Malaysia.
Correct.
I mean, for teenagers to go under birth control pills or condoms. Different in US and UK, they do supply it to high school children.
Yes, even in health clinics in overseas, it's free.
It's free.
Yeah,
you can just go and get it.
Yeah.
Here it's a taboo. So they know how to purchase it. Of course, they can't purchase it themselves. So they do have seniors to help them get it.
Correct.
So
but you see the whole thing, how they screw it up. Like this girl, she just, I mean, of course, we know that this friend, she is having sex, and then she does carry condom with her. And then now the school found out, the school will tell her parents, tell to her friends' parents.
Right.
And at the end of the day, it's either she's going to stop using it, or she's going to stop talking about it.
Yes, I think second one.
Right?
It's the second one.
Yeah. So I think how us as the society are making it taboo, making the girl to feel it is a taboo, it is something wrong. I think that is what we have to change actually.
Actually, yes. You know, that is what I wanted to ask you. But before I ask you, now you see this in a daily basis, right? So there are teenagers, 13 to 17. Have you encountered boys coming in for STDs?
Oh, yes.
I'm talking about young boys
Yeah.
for sexually transmitted diseases.
Yeah.
Okay, can you share some cases?
Most of my cases, most of my boys, younger generations, usually teens like 14, 16, 17 years old, within that kids, they would come in with the common symptoms of cold sore.
Okay.
Cold sores, which is they will have ulcers around the mouth or genitals areas and all that. So when they come in for this, you know, the next step is to do a blood screening, and herpes will come up positive. Most of them, they are not aware. Herpes, there's two types, type 1 and type 2. Type 1 is oral, type 2 is genital.
Yes.
Most of them will have type 1 positive. Why? Because they feel they are playing it safe. Oral sex only, what?
Oral
Cannot get
sex
pregnant,
is safe.
what?
Oral sex, cannot get pregnant means safe.
Yes.
What oral sex means can do. Okay.
So they are not aware of there is such thing called herpes and how you can actually contract it. And the thing about herpes is it's a virus that once you carry it, you'll carry it selama-lamanya.
Yeah, that's the thing.
Yeah, it will be there. Yeah, and it will be dormant. But the thing is, herpes is not necessarily through sexual. No?
Yeah,
You
that's
can
right.
get it from sharing towels. You can get it from sharing utensils.
Yeah.
There are other ways that you can get it. Because there are kids, young kids that I've seen, because most of them they got it from schools. That I have seen that cases also.
Yeah.
So that is another misconception lah. But they are not aware of you can actually get this kind of things. Yeah. Even some, I have young boys. I have a boy, 16 years old boy. He came in. He said that he feels that every time he pre-comes, it's a little different color. Because he knows it's normal.
Okay.
When you masturbate, you come, okay, normal. You know. But he feels that the cum is a different color.
Different color.
Yeah.
Okay.
Then when I asked him, are you are you sexually active? And he said yes. He was tested for chlamydia positive.
Oh my goodness, that's crazy.
Yeah, and
that is like
his girlfriend was an 18 years old girl.
So that means multiple partners?
One partner.
Partner.
Yeah, but the girlfriend is 18 years old. This boy is 16 years old. So he would have got it from the girlfriend lah. But again, I can only tell you what my patients tell me. I don't know whether they're telling the truth or not. They can tell, oh no, I swear I only have one partner.
Yeah, that's the thing. They don't tell you the truth. But as a doctor, people from the medical field, we actually know, isn't it? If he's getting it from the girlfriend got it somewhere else.
Correct.
So she's and the same. Oh my goodness. We're still again talking about children.
Yeah.
We haven't even gone to the adults yet.
Yes.
Right? And you have all this.
To be honest, right? I feel lately, adults, as in like those who are 30s, 25 and above lah, they have much more stable life, and they are the one who is not doing all these things. They are the one who is actually good girls and good boys.
Really? Huh?
They are the one with zero sex experience. They are the one who are having no sexual life. They are more like celibate like that, you know. A lot of them are going into spirituality already. 30 and above.
I guess you're right. After
They don't
all.
want they don't want all this. These younger generations are the one that we are dealing with. Yeah.
So this brings me to the next part, since we already started about STDs, right? So you also see this a lot among girls as well, right? STDs. And how does this make you feel? I mean, like, does this make you feel tired and worried about how the world is, going to be?
I have two girls as well. So every single time something like this happened, right, I will immediately think of them only. I'm like, ayo, how am I going to bring up my girls? But you'll be very surprised. I have a 6-year-old. She goes to kindergarten, and then she came back one day, I think a couple of months ago, she came back to me and she said, Amma, do you know period is usually for 5 days?
Okay.
6 years old. She doesn't even know what is period.
Okay.
So I was like, oh, okay, I think maybe it's the time for me to have the talk with her.
6 years
old.
No choice, right?
Yeah.
They already brought
So I had to tell her what is actually period, when you'll get a period. But okay, of course, roughly, just a rough figure, what is it? Why? Where did you learn it? From school, from her friends. So the friends are talking about what is period and how long will it take. And I'm lucky that she's actually telling to me.
Exactly.
Yeah.
So we know how to respond.
Yes.
We know how to increase their awareness.
Correct,
Not many parents are doing that.
Yeah, I still remember I was 12 years old where this one Malay doctor, she came to the school and she taught us how to use a pad. 11 years old.
Okay.
And that was my first exposure to what is a pad, what is a period. My mom did not talk about it to me.
There you go.
So no one, my teachers didn't talk about it to me. I remember the doctor, she was telling all of us, she put all the girls in a day one and she was teaching us how to wear and what is period and how painful it will be. And that is another thing that I would like to emphasize here. Because a lot of misconception about period as well. Painful period is normal. Especially in our Indian community. Then they say, oh, period is painful. Then they'll be like, oh, it's very normal, don't drama lah. You drink some nalla, you'll feel better.
Raw eggs.
Raw eggs, you feel better. Oh, the painful it is, the better, meaning your uterus is strong. Or the more bleeding, the more blood you have, the better it is, it's cleansing. But actually, no, we are missing out on PCOS, we are missing out on adenomyosis, we are missing out on endometriosis. How many cases where they are so bad, so severe by the time they come to us because of this misconception.
Very true. I mean, at least with this, you're increasing awareness in your clinic, right? Doctor, I just have another question. When you talk to these teens, right, where are they doing all this? Where are they having sex? I mean, it's not easy to have sex, isn't it?
Yes,
but
correct.
So
but
many
they don't mind.
Where are they? I mean, I'm sure they would have shared some
yes,
intimate details with you, because you got to ask them.
Correct.
So how are they doing it? Where are they doing it? Multiple partners? Is this common?
I have a lot of not to say teenagers per se, even adults lah, but mostly teenagers lah. They are doing it in just by the roadside. Also, they are okay at the park, at the padang. A lot.
How are they doing it in open spaces?
I always wondered the same thing.
Do you ask them? I mean, I'm sure you'll be curious.
I always wonder the same thing. Who are giving you the bravery to do this? I went to Morib last year. I just went to Morib. It was at night because we went to just simply get some air and have some nasi lemak by the beach. And when we were doing it, we were eating it in the car. We got it. We wanted to take out. The moment I on the flashlight, I can actually see a couple doing it in front of the car by the beach.
Seriously?
Yeah. It was a very young couple, probably teenagers or maybe early 20s, and they were doing it by the beach. And when I opened the light, they were like, baru nak pakai baju, and they were like, I was like, wow.
Wow.
Bravery that they have to actually do it in public place.
That's the thing. I mean, even if sometimes, we'll be so conscious, with the clothes we wear. I mean, I'm like that. Or sometimes, is something wrong with, my attire. I mean, we're talking about clothing.
Yeah, that's why I tell you, it's actually those who are in 30s and, above only who are being conscious like this. Teenagers, they don't care.
So that's the thing. You come across them telling you they're doing it everywhere.
Yeah, I have one, like the girl that got pregnant, right? The one I told earlier, 16 years old. It was in her own house. After the parents after the parents were asleep, she invited the boyfriend in through
Parents are in the house?
Yeah, parents are upstairs. She invited the boyfriend from the back door, come into the house, and then, of course, comfort at their own home lah. That one for her.
Oh my God. And I just want to tell everyone, this is in Malaysia, guys. Please don't think that we're talking about US and this is in Malaysia.
Yeah, you'll be
Malaysian
very surprised actually.
Our future.
Yes.
Who's failing? The kids or the adults
I
of
would
the society?
say everyone lah.
Education too, right?
Yeah, exactly. Education, us as society, making it a taboo. Let me just ask you lah, dear. In Tamil lah, period. What do we call period in Tamil? If someone come to period, how you say? Okay, I got my period. How you say?
எனக்கு period தான் அது.
Oh yes, usually they will say சுத்தம் இல்லன்னு சொல்லுவாங்க.
Oh yes, okay, சுத்தம் இல்ல. Right.
Yeah.
Okay.
So சுத்தம் இல்ல means I'm not clean.
Not clean.
Yeah. So that thing will be in your mind where period means it's not clean. Period means it's like something, it's a taboo.
Right.
So when you build a wall around it, the awareness should be there. It shouldn't be like don't have sex, you will have a baby. It should be like what will actually lead to it.
Yes. Of course. And this is what we are lacking, isn't it?
And one more thing, I think most of them, I mean, I'm not against it lah, but most of them are blindly trusting their partners. Whatever you say is like deva vakku like that. Yeah, I will listen to whatever you say. Even the boyfriend is like much older to them, and he had previous multiple girlfriends, and you are like, oh no, I've never done it. You will eventually trust it and believe it. I'm not saying don't, but always take a step back lah.
Yeah, think first.
Yes,
analyze
Malaysian
first.
government, in order for you to get married, according to the Sharia, Mahkamah Sharia, for Malays, you have to do an HIV test.
Oh yes.
You have to go for cruises for 3 months.
Yes.
It doesn't apply for non-Muslims.
It doesn't apply.
Which I think Malaysian, I've also spoken about it in one of my TikTok. I think Malaysian have to make it compulsory for everyone to do it.
I agree with you.
Yeah. Doesn't matter. Even your ones, no mind, you want to do, I also will do.
Yes.
Both of us, let's do together. Yeah. STD screening is a must. Not only HIV, but STD screening. And I think it's also must for couples to go for course.
Right.
To know about what are you actually stepping into.
Exactly.
Yeah, so we can avoid all this.
Very true, doctor. Now it brings me to the adults for a bit. When you encounter STDs, right? So do you also encounter stories or real cases where they're getting STDs because their partners cheat on them? So can you like
plenty? Okay, I have 2 scenarios.
Okay.
This is one scenario that I would say. A patient came in for her regular HPV. She wanted to do pap smear initially lah.
Okay.
So she wanted to do yearly pap smears, and I suggested let's do HPV. HPV, it's easier. You don't have to go through the pain of a speculum. You know, it's just a cervical brush. You do it yourself and you pass me the specimen.
Right.
So tak payah malu, tak payah speculum. So they were like, oh, okay, this is something which is new, and they are open to it.
Right.
HPV testing is also very crucial because you're testing for cancer.
Cancer, yes.
Yeah, mainly the virus, HPV virus.
Correct.
Lah.
Yeah.
So we did a HPV test for her, and her HPV came back positive.
Okay.
We have 23 genotypes.
Yeah.
So there is a certain genotypes, what it indicates, not necessarily cancer. So one of it came back as positive. She got no symptoms, nothing.
Okay.
Perfect, normal, healthy girl lah. So proceeded to do a full body medical test. Her herpes came back positive.
Okay.
And she was like, okay, she was telling me I did not have any other herpes type 2 genital.
So it's genital.
Yes.
It's through sex.
Correct. So I did not have, it was only my husband, and she came back a few days later. She was crying. She said, no, my husband is telling it's all because of me lah, this lah, that lah. I can swear on my kids I've never had any. I'm like, okay, never mind, let's test your husband. Since you are positive, your husband should be positive as well.
Right.
Husband, segala, semua positive.
Oh wow.
Syphilis positive, chlamydia positive, hepatitis 1,
all the STDs he's carrying is a bank or what? STD bank. Did you ask her? If I was there, I would have asked you, bang, you STD banker.
Semua ada.
What is this?
Macam-macam ada. And then I was like, and of course, it's very important when you are counselling, even though they are partners, you have to do it separately.
Yeah,
you cannot do it together.
Heartbreaking, isn't it?
Yeah, because it's a patient-doctor confidentiality. So when I was talking to him, then he was like, oh, all this was before marriage, sebelum kahwin. Then how now suddenly? Then I was like, sampai hati you actually go and blame your wife for having another partner. And he just laughed it out. He said, oh, if I did not tell her first, if I did not accuse her first, she's going to accuse me.
That's the truth, isn't it? What is that to accuse? I mean, that's literally you.
Yeah.
I mean, you're promiscuous, and then, oh my goodness, he can actually laugh it out, huh? And she's innocent right there. I mean, all this breaks your heart, right?
Correct.
I mean, you can only go that much, but after that, what happens in their lives? Do you think about it?
Too much already. Too much
saturated.
There's a saying, you know, when you are going out of your workplace, right? You're supposed to leave your heart, leave your heart out before you walk into your work.
Yeah.
And then when you're coming out, then only you collect back your heart. You know.
Oh my God.
You cannot do that.
It's not easy. I can't do that. I mean, I
yeah.
carry my heart everywhere,
Yes,
so that's why I
yes.
get burnt out sometimes.
Yes, that's what tend to happen because our emotional burden is too much.
It's too
that
much.
we keep it in our heart a lot.
Yeah, because besides being a doctor, besides treating them, you're a human too, and you're definitely going to feel sorry. You're definitely, after they go back, what is that lady's, you know? But how about the second case? You said there was a
second is a very interesting case.
Okay.
This woman, she's a trans woman.
Okay, trans woman. Okay.
She's a trans woman, and men will go changed into a woman lah.
Fully transformed.
Fully transformed. So she came in with, she said she has foul smelling and she has like infection down there, which is pretty common actually. I was very surprised. A lot of people were not aware. Pretty common for you. Why? Because you don't have a normal flora down there, not like girls. So it's not self-sustaining. It doesn't clean by yourself.
Right.
There are some necessary precautions that you are supposed to do after an SRS. Okay.
Right.
So my thought was like, okay, probably that lah. So and then I swabbed. It came back as herpes, and she came back as herpes and chlamydia positive. Okay. And then when I asked her what is actually the issues and all that, she was involved with a married man.
Married man. And she's okay.
She's a trans woman and she's involved with the married man. And by right, when you have a certain, like even HIV or there's a certain indications for us lah, we have to notify.
Of course.
We have to notify.
Partner notification.
Yes, we have to notify to KKM as well.
Right.
And KKM will identify who are the partners.
Right.
Because these are all very serious cases, you see. And then had to notify the partner will have to notify the wives. And I got ambushed in the clinic by the wife.
Oh dear, ambush.
Yeah, because the wife was not aware of all this were happening. And they just assumed that I tengah complot with the girl, the trans woman, and I was a family member because this is an Indian community, Indian girl lah. So they just assumed that I'm purposely making a ruckus because the wife was aware of the husband having a fetish.
The wife is aware.
Yeah.
Is she allowed?
Yeah.
Then why want to come and ambush you?
And then she was like, Indians what? They like drama.
You are right, I guess.
Thank God I got CCTV in my clinic.
Thank
I tell
God
you,
for that.
so many instances.
Did you ask back the wife? You know your husband got fetishes for trans women. Why are you ambushing, dictating lah?
Yeah, you know. Because one thing when I'm at work, you know, and I have patients and I have so much of things, and to be honest, I got no time. Yeah. And when all this were happening, I was like, okay, who are you? She was like, oh, she just came in and she was like, oh, you are supporting this community and you are also one of it, right? And blah 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 blah. And I was like, okay, what is going on? And by the time I finish what is actually happening, she already chow already. And then that girl, the later at night, that trans girl, she is the one who contacted me, and she was the one who explained all this to me. This lady, she just came, she just macam buang all her anger to me, her frustration to me, and then she just chow already. She was like, oh, I'm gonna make you viral. I was like, okay, viral for doing STD screening.
How is that? something to me, you know.
Yeah. So
crazy, right?
Also happens in a lot of married couples. A lot. You'll be surprised how many married women or married men, as a matter of fact, married men are aware that their partners have another partner.
Okay, so usually what is common and what is usually what usually comes out is the
I
woman.
have a
now men, you're
patient.
saying, okay.
Yeah, I have a patient where this couple, a beautiful couple, they have a son. I know them through the son lah. The son is my patient, and then the wife came in for screening, and then she suddenly opened up. She told me she wanted to do STD screening and pap smear and all that because they are in an open relationship.
Okay, so they are telling that they're in an open relationship.
Yeah. And then I was like, oh, okay, so you're okay with your husband having another partner? She was like, oh no, my husband doesn't have a partner, but I do have a partner. And your husband knows about it? Yeah, my son is aware he has 2 daddies.
Oh.
Indian community, Indian,
But this is not open relationship, right, doctor?
Open relationship lah.
The husband doesn't have anyone. It's only her.
I thought it was open relationship when they open their marriage, no?
Open the marriage, yes, but usually it works when both sides open. So if one side is saying okay to the other person, that person is forced to say.
But is it still considered infidelity if the husband is?
The husband is aware of it. What?
Yeah,
it's not.
It's like dimadukan, but the other way around.
Other way.
Yeah.
So the husband is deciding to stay in the marriage, maybe for the sake of the boy.
Son, maybe, yeah.
So usually we see this in women, but now you're telling me about the man saying okay to the woman.
A lot the other way around.
So she come and tells you boldly, I want to do STD screening because I'm sleeping with another person and my son is aware with 2 daddies. That caught me. Seriously. How is this? Okay.
The son is a small boy lah.
We don't have enough time.
He's a 3 years old boy, I think.
So for now, for him, it's a plaything. A nice man coming and
correct.
I mean, this is crazy.
I even asked her, if you're not happy with your partner, why don't you just divorce?
Yes.
Because she said she's aware that her boyfriend is not financially stable.
You gotta be kidding me.
And her husband cannot satisfy her the way that her boyfriend does. So when she discussed this about divorce and the husband is like, okay, don't divorce, let's just open it up. I'm okay with it. Just that for public, let's just stay as a partner. Yeah, we are a family, and then you do whatever you want to do in.
But again, the husband is not doing it
according to her.
But at one point, I think he's
I don't know lah. We don't know how, right? Yeah.
That's crazy.
And there are girls who are okay to be with another married man despite knowing that they're married.
And then they just come for testing. So you do your doctor job.
We can't interfere in their personal life, right? There should be a limit, but
but this is the reality, isn't it? Look at our ecosystem. Look at how humans are. I mean, one day won't be
they
enough.
say like men's population is 2 to 1. More men compared to women nowadays.
Also, that is why.
So I'm justifying their actions now for you.
Ayo. Okay, calm down, calm down. Okay. There's just, too many things in my head now. One day won't be enough. But seriously, doctor, I mean, jokes aside, laughter aside, but this is the reality. I mean, these are real cases, and we're talking in terms of science and also medical medical situation, but it's so normal for people, isn't it? And HIV cases, I'm sure you have been seeing in this group a lot of HIV. Plenty.
Yeah.
People still think HIV is not a thing.
Yes, correct. People, rather than HIV, I think it's very important for people to know there are more to STIs, sexually transmitted infections, than HIV. People are not aware what syphilis can do, what chlamydia can do, what herpes can do, what any other STIs can do to you, to the people around you. I have a married couple. They came in to do STD, and when I asked the wife, "You're married, why you're doing?" And then he said, "Oh, dia kantoi curang."
Just like that.
Yeah, in front of me, and the fellow was like just straight face like that. I'm like, okay. And then his came back as herpes type 2 positive. And then tested the wife, was also positive, and then tested the son. The son has herpes type 1. Why? Because you're sharing utensils with your son. Why? Takkan you don't want to share. So a boy which is like 1.5 years old is tested positive. So when we see cases like this every day, right? At one point of time, you are just like, okay lah, cannot do anything already.
Adults screw up.
Yeah, it's like children's victims. So I guess it's very important for us to bring up our kids and make sure that we have the awareness. It always starts from home.
Yes.
Make sure that our kids are very well aware of what is happening, what is going on, and what are the restrictions. Then one
day is not enough with you, doctor. We definitely have to do part 2. But now I'm just going to go to the next part.
Okay.
Infertility, PCOS and all that. So I mean, like, I think infertility is a thing in Malaysia, even though people don't want to admit it, right? And a lot of times the women are blamed for infertility, and they go through processes like IVF and so much of money. And then sometimes it's not about them, it's about their husbands.
Correct.
So maybe you can talk a little bit about this and the scenarios you face.
Personally, I don't do infertility counseling or screening because that's out of my scope. But I do have patients who are coming for, like, you know, screenings and all that. So this kind of cases, or just normal, those who are TTC couples, what we call trying to conceive. TTC couples who comes to me and you know, they just want for other, like Monjaro or probably for like their PCOS, other follow-ups, then tend to go into this lah. So when they speak, I have a patient. She is 35 years old actually. So she has been through a very long process. She has PCOS. 2 cycles of IVF failed. So when she came to me because for PCOS management lah. She wanted to take, she is quite obese lah, to be honest. She's about 100 plus kilos. So she wanted to lose weight. So she came for Monjaro counselling and then she wanted for her PCOS as well, and also for your fertility. And so 2 types of IVF. Cycles fails, and I told her, like, the husband is very supportive, he always comes. So I was telling to the husband, why don't you go and check also? Then he was like, why should I check? I mean, like, we know where is the cause, right? He was just showing like to the wife, we know where's the cause, right? I was like, the thing with TTC, the thing with having a baby, it's a teamwork.
It's a team.
How can you cannot do it just by yourself. Even natural way also, it's a teamwork. What more IVF, right?
Oh my God.
So there's a misconception. If you go at PCOS, you cannot get pregnant. If you're fat, you cannot get pregnant. There's no such thing.
Exactly.
It's not by default, by book, that it is like that. So that is the reason why all these testings all is there, right? So I was telling him, Mala, just go do. Every time she comes for her injection, every week, right, weekly injection, I would tell him, check already now. Actually, just for fun, like, because he's a very jovial kind of person. And then the week after, he did not come. So I asked the girl, hey, what happened? Your husband has been very supportive in your weight loss journey. You know, it's very empowering to see a husband who is supportive in your weight loss journey, right? Supportive, he always comes and we always joke, you know, he's very jovial and all that. What happened? Where is he now? And then only she told me that they finally did the screening. Finally did the sperm analysis and found out he has azoospermia.
That means he is the cause, no sperms.
Yes.
Jeez. And they did 2 cycles of IVF.
Correct, 2 cycles of IVF, and it was failed. And I found out that he has azoospermia when he is actually a normal BMI. He's a non-smoker, and he's like a very healthy being. And you see the change in behavior where he stopped coming. Because
after seeing his results.
Yes. Why? It's not, bukan malu tau. Tapi it's more like, I don't know how to explain that thing.
They feel men shouldn't be the problem.
Yes.
If you cannot get pregnant, it's the woman.
Correct.
That's
That's why I always say, every time before you are going into IUI ke, IVF ke, or before you are jumping into infertility, screen both husband and wife. Both have to get screened. Both have to make sure that they are in the peak of their health.
Exactly. And they have to accept the findings, isn't
something
it?
as simple as smoking will also affect your sperm count. A lot of them were not aware of it. Second thing is, of course, your lifestyle. Your sleeping habits, you're not eating. Even though you are in a normal BMI, you can still be pre-diabetic.
Yes.
And that will also affect your sperm count. A lot of them are not aware of it. And just because someone is big size doesn't mean that they are problematic.
Sometimes they're okay, right?
There are big size men who are also been getting pregnant, their wives are getting pregnant, no issues.
So the whole thing is, like, when you screen, both people do it. It's not just one gender, isn't it? So I think during this period of time when they come in and then they find out it's the guy, they'll definitely have friction in their married life, right? Because the guy will get angry.
It works both ways lah. Both also have to concurrently get the treatment done. Both also have to get tested when you plan to do IVF. Yes.
Lots of information. Seriously, I mean, like, we had such an amazing session. As I said, one session is not enough, but so much of insights, like, you know, very important insights, especially for parents, you know, for teenagers, and also for married couple, and a lot of things that we learned, how actually people define marriages these days. I think it's just beyond any dictionary or any vocabulary or whatever. But a lot of things, right? And when you talk about PCOS, maybe a little bit about PCOS, how severe it is.
Okay.
Where you can just say the whole term and then how severe it is. among young ones, middle-aged women, or
this one,
anything like
okay,
that.
PCOS, like 14 years ago, it was when they came up with the term PCOS, polycystic ovarian syndrome.
Right.
Last month, they renamed it PMOS.
Why?
Polyendocrine metabolic syndrome.
Okay.
Why? Because, very good question. So why? It's because of the confusion around PCOS. A lot of them have this misconception where PCOS means you have to have cis. If you don't have cis, meaning you are not PCOS. But it doesn't work that way. PCOS is like a tip of an iceberg, you know. There's a lot of things beneath it, which is why when the name change happened, it was very, very helpful. Polyendocrine, meaning it's head to toe, all kind of your hormone system. Metabolic, because that is the root cause, your metabolic syndrome. Insulin resistance is what causes PCOS. And ovarian, which is what get affected, and syndrome lah. That's the thing. The main issue is that a lot of women have been having PCOS, PMOS lately has been renamed, is because of insulin resistance. It's 4 causes. Mainly 70% is insulin resistance can cause PCOS. Thyroid or hypothyroidism can cause. Inflammation can cause. And post-OCP, meaning those who have been on a long-term birth control pills, can also cause uterine cysts.
A lot of them start young, isn't it?
Yes, they start young, and because of to treat PCOS, they start this, and then it will worsen, and then it's like a cycle, you see. So that will actually affect in all this manner lah.
Right. So it's quite severe. It's quite a severe health concern, isn't it?
Yes.
Among ladies and young
especially
women.
If you were to take ethnicity, right, it is much more, the alertness, the awareness about it is much more vast among the Malay community compared to the Indian and the Chinese community.
So the prevalence is higher among Indians and Chinese.
Correct. Even there was there was a studies done by UPM University Putra Malaysia, I think last year or early of this year. So the studies were said that 12.6%, which is almost 13% of women of reproductive age meaning 11 to 49 lah. They 12.9% of them has PCOS. However, 70% of them are undiagnosed, meaning they do have the symptoms, but they have not been said that they do have it. But what's even more shocking is that 44% of women of reproductive age has metabolic syndrome. So just say, for example, here you and me, there are chances that either one of us have a metabolic syndrome.
Yes, of course.
And metabolic syndrome is insulin resistance. The main cause is insulin resistance. Lifestyle, cortisol, sleep, sugar, stress.
I say that at the same time. Because that's pretty much what's going on in everyone's life.
It's a misconception. Everyone says that, I'm not fat, so there is no chance for me to get PCOS. It doesn't work that way. They
feel they're okay if they're slim, they're thin, they're looking okay. But inside, nobody knows until you go and get it checked.
Correct.
Isn't it? Amazing, doctor. What do you have to say to our people? I would like you to just, come from your heart, like how it was. It was totally a heart-to-heart, raw, unfiltered conversation. That's why I'm telling you, one session is not enough. Maybe after a month, we come back again. But what would you like to tell our young viewers, middle-aged viewers, older women, men? Go ahead, sis.
Okay, so I would say that this is from me personally lah. Please don't make me viral. But this is from me personally. I'll say that it is good that you trust your partner, but only until a certain extent. No matter what it is, screening is important. Health screening is important. Having a heart-to-heart talk is important, but even that also, a lot of them has been able to conceive it. So trusting your partner, make sure that you stand your ground. And as of women, just because you are in a bigger size, or just because you are thin, just because you are in a normal range, don't think that you are safe from any other symptoms or syndromes available out there. If you feel there is something wrong with you, or if you feel like even something as simple as hair fall, or something as simple as period pain, please get checked. There's a lot of things that you can avoid rather than making it worse when you detect it early. So
Thank you, doctor. Again, thank you so much. Today was amazing. I mean, we had certain things planned, but once we started, it was just like flowing, isn't it? I felt so happy, and I learned a lot of things because, first about you and how you have started, like how you motivated yourself in your darkest moment, and how you're empowering so many people out there, how you're helping lives out there. It's remarkable. Thank you so much. And we will definitely have you again, because this is not over. We have so many more things. I'm sure right now you have it inside to share, which is definitely important, isn't it? So we'll definitely have you again. But till we see you again, thank you so much.
Thank you for inviting.
Thank you. Okay, so thank you everyone. Thank you so much for today and for watching our episode. Dr. Nithiyah had so much of fruitful, important information which is very, very important for us to understand so that you can help people around you, you can help your young ones at home, guide them towards safety, and also yourselves in relationships and how to take care of your health. So we will definitely have her again. Thank you so much, and till we see you all again, do not forget to subscribe us on YouTube, TikTok, Insta, Spotify, and thank you to our sponsors, Superboost. Till I see you all again. Bye bye.